We're going to discuss some causes of proteinuria now. There are different types of proteinuria that we need to know about as we deal with them. Transient proteinuria can occur with fever or exercise. People talk about march hemoglobinuria. People that march a lot and can have hemoglobinuria, or that run a lot. Same thing can happen with excessive exercising. You can have proteinuria. The most common form of proteinuria in children that's persistent is going to be orthostatic proteinuria. Merely they stand up. So in these patients, a quick screening test is to get a urinalysis while they're still in bed before they get up and start moving around, and you notice that there's no protein there. Later on when you're moving around, you get a urinalysis and there's protein. It's probably orthostatic proteinuria. And that's the first thing you should think of for proteinuria. Nephrotic syndrome is a disease that manifests with proteinuria, and these are the components of nephrotic syndrome. Number one, proteinuria. This is another one of these autoimmune diseases. Many times it occurs after a mild URI or viral illness, and then they start having leaking of protein into the urine. When they leak protein into the urine, over time they're going to start losing or having low albumin in the blood. So now we have proteinuria and we have hypoalbuminemia. When you lose the albumin in the blood into the urine, you're going to start having edema, because albumin is responsible for the maintaining oncotic pressure. So fluid starts to leak into the tissues and you get edema. The fourth component, the fourth domino, is the hyperlipidemia. One of the things that happens is, as you're losing protein, you're going to lose some enzymes, and some of these enzymes are responsible for breaking down cholesterol and lipids. They're no longer there, and sometimes you actually make other products and you get hyperlipidemia. So all these dominoes are tumbling one over the other. The majority of nephrotic syndrome in children is the minimal change disease. The other kinds are listed there, but the most common one is minimal change disease. Fortunately, with nephrotic syndrome, the majority of patients have full recovery. Usually at around 2 to 6 years of age for minimal change disease, and again, as I said, after a minor infection like a cold or gastroenteritis, something like that. Usually the parents will bring the child in because they look a little puffy. Sometimes in the morning when they wake up, they look puffy around the eyes. The puffiness tends to go down with time because they're sitting up and water goes downhill, so it kind of drains a little bit. But they also may notice that there's some puffiness of the feet and some indentation on the skin from, for example, the elastic band on their underwear or the socks, and the parents start noticing that. In extreme cases, the faces are very, very puffy, and the puffiness doesn't go down throughout the day because there's just so much edema. They can have diarrhea and abdominal pain, and some patients will have hypertension. Some patients have what we call nephrotic nephritis, so they will have some of the components of glomerulonephritis. A UA is a good screening test, and it shows proteinuria. A 24-hour urine will show much more proteinuria. The creatinine is usually normal, maybe normal high. The albumin is low, so you need to get blood work and urine work. Their cholesterol and triglycerides will be elevated. And in this case, as opposed to glomerulonephritis, the C3 is normal. And glomerulonephritis is low. The C3 and C4 is normal in nephrotic syndrome. Remember that when you're looking at the labs that they give you on the test question. Most patients that have mild disease, you manage them sometimes even without the steroids. You can manage them with salt restriction and diuretic. Some of them will require steroids. Most patients don't even require a kidney biopsy for differentiation of the disease. You should biopsy them if they continue to get worse or not respond to your treatment. Severe disease, you probably need to put them in the hospital. Again, fluid restrict, salt restrict, diuretics, and consider biopsy. Very important to remember, patients with nephrotic syndrome are at increased risk for infections, particularly what we call spontaneous bacterial peritonitis. Remember that for the exam, really important. The majority of patients, it waxes and wanes, so they'll get better, they'll have a remission, then a relapse, and remission, and eventually it tends to go away.